Now, Olivia and I are just two examples of women who have caught their breast cancer in the earliest stages, yet only 10% of women perform breast self-examinations.
Well, actually, you're the type of ladies that surgeons like to hear about because you were proactive in your care. And Olivia, in particular, I remember your story was that you had sensed that something was wrong, and you actually had to be very proactive in getting diagnosed. And things were overlooked for a little while. Unless you had done that, things might have been a little bit different. But it is really kind of tragic that such few women practice breast self-examination, and even the ones that do don't actually do it correctly. So it's extremely important that we educate women to do not only breast self-exam, but to also do it correctly.
Right.
And I think that's one of the missions that we're on, as we discuss the issue today, is to educate and empower women on the power of breast self-examination and awareness of yourself. And keep in mind that it's extremely important. We're not asking women to do an exam and diagnose the fact that they have breast cancer. We simply want them to become familiar with the feel of their breast, so that if there's a change, then they can report that to their healthcare provider for further follow-up.
And also, most of the time, it's benign, isn't it? And so people don't need to panic that every time they find something, it's something serious. But the more aware you are, the better chances you are of finding something. If it was serious, you find it early.
Absolutely. And, the fact of the matter is 80 to 90% of the time it is benign. And one of the misconceptions about breast self-examination that's come up in the media lately is the anxiety induced by women who find a lump. And this is, it's a little bit irresponsible in my mind, because clearly 1/3 of the women that I treat, and I treat a lot of women every year with breast cancer, find their own lumps and they either have a negative mammogram or inconclusive mammography and other ultrasound studies and whatnot. So 1/3 of ladies that I see have a normal radiologic evaluation and wind up having a malignancy. It's very scary.
That's scary. Huge. So we have a little demonstration device here. I'd like you could just show me exactly when someone's doing an exam, what are they supposed to be doing?
Absolutely. This is actually a very good little model. It has a number of little lesions hidden within it. And basically what we try to educate women to do is to either use the what's called the lawnmower pattern or the circular pattern of examination. And it's very important that they use the 3 levels of touch, so the soft, the medium, and then the very hard pressure, because the soft pressure will usually find a lesion that's very superficial, as demonstrated here, but the deeper lesion really requires a significant amount of pressure.
Wow, so you're really pushing down.
You really need to push, and and this is where the Liv comes in so valuable, because it makes this examination so much easier and so much more accurate.
Yeah.
And we'll demonstrate that shortly.
I'd like that, absolutely. So you're basically saying you need to do just sort of a light touch initially to get the surface level lesions.
Correct.
Little harder for the second go around, and then because this one's very, very deep, so you have to really push way down.
And ideally you'd be laying down, with a pillow propping up your arm, so that it actually brings some of the breast tissue forward, making it a little bit easier to do the examination. You don't have to hurt yourself doing it.
Just use some firmer pressure.
Right, exactly.
Now, I'd always been told when I was younger to do it, perform one in the shower. That's no longer the recommendation, right?
Well, it depends. This is another controversy. I think that a lot of women, because they have access to themselves during a shower and they have soap on, they sometimes will find lesions. They're not really doing a self-examination. They find it accidentally. But the preferred method is laying down.
Yeah.
And then the enhanced method is using the Liv, which we're going to talk about and discuss in great detail.
Yes, I was never one to do an exam because I never knew how to do it properly. And I would always, try to do one every once in a while, and I would feel a lump and not know if it was normal or not normal. But basically what I'm hearing you say is that it's just every month, if you perform an exam, you start to know what's normal for your breast.
That's correct. And it's also very important to do the examination at the same time of your menstrual cycle each month. So usually a few days after the menstrual cycle is finished is the best time to do it, because your hormonal levels are the lowest. And so a lot of the lumpiness that almost all women feel is at a minimum right after their normal menstrual cycle.
I never thought I'd be someone that would have breast cancer. I always exercised and ate well, and I was never overweight, and I nursed both of my children. and it just didn't seem like something that would ever happen to me. And when I found out, it almost was as if it was being told to someone else. It didn't resonate with me. I don't know about for you.
It was the same story, really, because, you know, I always ate well, exercised, didn't smoke. It's not in the family, it's not in my genes in any way. So it just shows you that, no, you don't know when it's going to happen or who it's going to happen to. So I'm just very grateful I'm here, and now we can educate women on how to protect themselves and to do early examination. And this is just a wonderful way to love yourself, really.
Absolutely.
You know, to take
and you
care
were
of
the
yourself.
creator of the Liv as it exists now.
Yeah, I'm really excited.
Love the
I actually
design.
designed the
It's
shape.
beautiful.
Was so taken with the whole thing that I wrote Liv on there. It was like perfect.
And this is the
And
logo
here it
that
is.
exists
Liv
from
has
the
a life.
napkin. And how'd you come up with these beautiful colors? Were you?
Well, the color purple is a really healing color. Pink, of course, is representative of the breast cancer sign and has been for a while. So I thought healing, the logo that's been kind of known for pink, and the heart, because if you love yourself enough, you'll examine yourself regularly for your own health and for your family's sake. You know, take care of yourself. It's really an awareness thing to get women aware. It's not to replace your mammogram. It's not to replace going to the doctor, but it's just something you can do for yourself regularly so that you can keep tabs on yourself, really, and start young. Girls should start pretty young. How young, Dr. Whitney?
Age 20.
20.
Yep.
Wow.
And
we didn't know that.
I know. I never knew that.
There's a very frightening trend that I'm seeing in younger and younger women are being diagnosed with breast cancer in their 20s. And it's a very frightening thing that's going on out there. Part of it's awareness, part of it is that they are doing some self-examinations and finding things, but there's a very scary trend. And we don't know whether it's because women are starting to menstruate earlier these days. There's more hormonal replacements in the foods that we eat, you know, and both
water,
of you,
everything.
we're poisoning ourselves, and you know, both of you ladies bring up a very interesting point. And both of you are very healthy and fit, and obviously educated, have access to health care, and yet you've been struck. And so breast cancer really strikes randomly, you know, and there is no protection. And the fact that family histories are negative is really not a protective effect at all, because 75% of women who are diagnosed with breast cancer have no family history.
Wow, is that
That's
high?
amazing
That high.
to me.
I didn't realize it was that high.
And people, you know, the ladies have a false sense of security. They go, I don't have any breast cancer in my family, so I don't have to do an examination. And, you know, here is living proof that you do.
That's what I find, that a lot of women I speak to are really afraid to self-examine themselves because they're scared they'll find something. And I always say, but listen, if it is something, and it probably won't be, better to find it early.
I would think so,
than
absolutely.
leave it until it's large, you know, and it's more difficult to treat.
What's the benefit of doing a breast self-exam with the Liv versus doing it with your hand?
Well, what this does is it's really kind of a magnifying glass for the hand, if you will. And basically, you know, we've demonstrated this on a number of different ways.
Can you
But
move this out the way?
this is a good little demonstration piece. This is a little sponge with grains of rice that are embedded in it. And if you put your hands on it, it's, you know, if you push hard enough, you can feel a few of the things. Olivia, you want to try that? Kathy, try it too.
Oh, yeah.
So you can feel it, but then when we place the Liv on it, and then if you try and feel it, see what a dramatic difference it makes. That
Oh, yes, it's so much easier
What
to
this does is
find. You don't have to put so much pressure on it.
hardly at all. So try
That's
this, Kathy.
incredible.
What this does is it decreases the friction between the fingertips and the skin,
Wow.
allowing you to do a more thorough examination and bringing out lesions.
It really glides.
It's amazing, isn't it?
Yeah, that's
It's
great.
I wish that the audience could actually feel what we're feeling. I know we're talking about it, but just to feel this demonstration is absolutely remarkable. So, you know, and also, I mean, I like this device so much because it's a reminder. You know, like I said, it's a beautiful device. It's a reminder for the ladies to go ahead and do that exam. You know, once a month or every other month. You know, you don't have to do it every week.
Right.
You know, because you know some ladies do overdo it. So, but you know, it's a wonderful tool.
I think so too, and I'm just amazed that there is so much controversy out there right now about whether or not to do a breast self-exam. It just seems like, why not?
I don't understand the controversy. I mean, it's just a way of self-examining is obvious. Your fingers are your best way of knowing yourself, you know.
And you're your best way of
Yeah,
knowing yourself.
exactly.
To discourage that, it doesn't
It doesn't
cost
make
money.
sense.
It doesn't take
It's
a
not
lot of
common
time.
sense, as my mother would say.
I know, it doesn't make sense to me.
It's very irresponsible to discourage breast self-examination, and you know, really, again, our mission is to educate women not to be afraid of findings that they have, because the majority of them will be benign.
Yeah.
And then the few that are malignant, if they're found early, as evidenced by you ladies, you're doing great. You're cured. And